Hello and welcome. Today we're diving deep into the urinary system to explore a condition that causes significant discomfort and potential complications: Struvite stones. We'll uncover what they are, how they form, what signs to look for, and how they're managed. So let's get started. Struvite stones, also known as infection stones or triple phosphate stones, are primarily caused by urinary tract infections with specific types of bacteria. These bacteria, such as Proteus, Klebsiella, Pseudomonas, and Staphylococcus species, produce an enzyme called urease. Urease breaks down urea, a normal component of urine, into ammonia and carbon dioxide. This process significantly increases the pH of the urine, making it more alkaline. The alkaline environment created by the bacterial breakdown of urea is the key to Struvite stone formation. In this alkaline urine, magnesium, ammonium, and phosphate, all normally present in urine, become less soluble. They then precipitate out of the solution and begin to form crystals. Over time, these crystals aggregate and grow, eventually developing into large, often staghorn-shaped stones that can fill the renal pelvis and calyces of the kidney. This process disrupts normal urine flow and can lead to further infections and kidney damage. Struvite stones are more prevalent in women, possibly due to a higher incidence of urinary tract infections in women compared to men. They are also more common in individuals with certain underlying medical conditions that predispose them to recurrent UTIs, such as neurogenic bladder or indwelling urinary catheters. While the exact global prevalence is difficult to pinpoint, Struvite stones account for a significant percentage of all kidney stones, particularly in patients with chronic UTIs. The symptoms of Struvite stones can vary depending on the size and location of the stones. Some individuals may experience no symptoms at all, especially if the stones are small. However, larger stones can cause a range of symptoms, including flank pain, which is a sharp or dull ache in the side or back. Hematuria, or blood in the urine, is also a common symptom. Urinary tract infections, often accompanied by fever, chills, and dysuria, which is painful urination, are frequently associated with Struvite stones. In severe cases, the stones can obstruct the flow of urine, leading to hydronephrosis, a swelling of the kidney due to urine back up, and potentially kidney damage. Diagnosing Struvite stones typically involves a combination of methods. A urine analysis will often reveal an elevated pH, the presence of bacteria, and potentially crystals. Imaging studies, such as a KUBX, a kidney, ureter, and bladder X-ray, an ultrasound, or a CT scan, are essential for visualizing the stones and determining their size and location. A CT scan is often the preferred imaging modality due to its high sensitivity in detecting stones of all compositions. Finally, urine culture can help identify the specific bacteria causing the urinary tract infection, guiding appropriate antibiotic therapy. While other kidney stone types have many different classifications, Struvite stones are mainly categorized based on their size, location within the urinary tract, and whether or not they cause obstruction. The term staghorn calculi specifically refers to large Struvite stones that fill the renal pelvis and branch into the calyces, resembling the antlers of a stag. These are the most complex and challenging to treat. Treatment for Struvite stones focuses on two main goals: removing the stones and eradicating the underlying infection. Antibiotics are crucial for treating the UTI and preventing further stone growth. However, antibiotics alone cannot dissolve established stones. Stone removal is often necessary and can be achieved through various methods, including percutaneous nephrolithotomy, as PCNL, which involves making a small incision in the back to access the kidney and remove the stone; extracorporeal shock wave lithotripsy (SWL), which uses shock waves to break the stone into smaller pieces that can be passed in the urine; and ureteroscopy, which involves passing a small scope through the urethra and ureter to reach the stone and either remove it or break it up with a laser. In some cases, open surgery may be required for very large or complex stones. Preventing Struvite stones primarily involves preventing and effectively treating urinary tract infections. This includes practicing good hygiene, such as wiping front to back after using the restroom and drinking plenty of fluids to help flush out bacteria. Prompt treatment of UTIs with appropriate antibiotics is crucial. In individuals with recurrent Struvite stones, long-term antibiotic prophylaxis may be considered to suppress bacterial growth. In some cases, medications to acidify the urine may be prescribed to reduce the risk of stone formation. The prognosis for individuals with Struvite stones depends on the size and location of the stones, the effectiveness of treatment, and the presence of any underlying medical conditions. With appropriate treatment, the stones can often be successfully removed and the infection eradicated. However, recurrence is common, especially if the underlying cause of the infection is not addressed. Recent research has focused on developing new antibiotics that are effective against urease, producing bacteria and on exploring novel approaches to dissolving struvite stones using chemical agents. Ongoing research continues to seek better ways to prevent and manage this challenging condition, ultimately improving patient outcomes. Thank you for watching.